Thanks for staying with us. We begin the second half in Abuja with our global coverage of the coronavirus pandemic. As the country reaches a critical level where the capacity for hospitals will no longer be able to cope with more serious COVID-19 cases, health workers have been advised to maintain a high index of suspicion for COVID-19. They will also be forced to make tougher decisions in the face of daunting challenges during the fight to tame the second wave of the virus in the country. Kemi Balogun reports.
As we see more cases, we will see more deaths. This is almost inevitable because the more cases you have, the more deaths you'll have because of all sorts of demographical issues in terms of who is infected most in the population. With obviously every country in the world, Nigeria inclusive, is really struggling with access to oxygen.
This comes as Nigeria surpasses the 100,000 mark of COVID-19 infections. Experts remain worried that Nigeria has reached a critical level where hospitals will be unable to handle more serious COVID-19 cases across the country. Countries across the globe continue to buckle under the pressure of daily infections, leading to high health worker infections and deaths. With a mutating virus, the new COVID-19 variant in 23 African countries has not tilted the scale in terms of the rise in infections or deaths in Nigeria. There is, however, pressure on the health system in the country due to the surge in infections as most countries battle to control the second wave of the pandemic. The World Health Organization warns that it will be a difficult month.
It's a significant increase in the number of cases. We're also seeing in some of the countries an increase in the deaths, which might be attributed to the systems getting overwhelmed and therefore the quality of care and the type of care available to people being compromised. I think what we just have to understand, I can only repeat what my colleague said, is that there is a need to reinvigorate the response at different levels, at the level very much of individuals, of communities.
So yes, we understand very much that the biggest indicator for where we are on this outbreak is not really the number of cases. The biggest indicator that will put us under pressure is the number of deaths. So we must keep working very hard to save as many people as we possibly can.
Nigeria's capacity to fight this pandemic may be overwhelming given the lack of adequate funding in the health sector, the lack of PPEs for frontline workers, and bed spaces in hospitals. Health workers continue to bear the brunt and are at the receiving end of these increasing infections. And the word out there from experts is that everyone needs to play their own part to ensure that these infections remain low, thereby reducing the burden on health workers and the health system. Kemi Balogun, TVC News, Abuja.